Welcome to Time Warner Cable's Local Edition. I'm Brad Pomerance, and we're joined by Ted Lieu, member of the California State Senate. And sir, I want to speak with you about the Affordable Care Act and its rollout here in California. We know there have been challenges nationally with those states that are operating through healthcare.gov. But with Covered California, my sense is some bumps, but fairly stable. What's your sense?
That's accurate. Covered California did much better than the federal website, which everyone acknowledges was a disaster upon rollout. But here in California, we did it better, and we have been enrolling people every day, and we are on go to get a lot of people enrolled into health insurance.
I want to speak with you, though, and kind of dig deep into the numbers. What we see is that there are high numbers of folks that are enrolling who are older, maybe more infirm. In terms of the young, it's not catastrophic in terms of the numbers being just too low for the young, but not a lot of young people are enrolling, basically kind of at their population levels. And we need to see more than their population levels as a percentage of the entire whole. What can you tell us about young enrolling?
Well, I agree with that statement. We do need to have more young folks enroll. But again, this is going to take some time. I mean, we're ramping up a massive change in healthcare. And to measure what happens in the first few months versus,
I understand.
You know, a few years later, every
March
day that goes by, it gets better.
March 31st probably should be when we really look at this.
Correct. But what young folks should know is they could get amazing subsidies from Covered California. And young folks can get some very good health insurance for very low rates.
What's also interesting about the numbers is we look at the Latino population. They are half of the uninsured in California. They are 29% of our population. Yet right now, and you know, trends are still moving, only about 3% of enrollees in Covered California.
It's a huge problem. We definitely need to get not just Latinos, but also Asian Americans and really any ethnic group that has English as not their first language.
See, limited proficiency,
And that's why I actually authored a bill that the governor signed into law that says, look, insurance companies, you've got to translate your core documents into different languages. Because if you give someone who's not that proficient in English, you know, a website that's in English or a brochure in English, they're not going to understand what a deductible means.
But what's interesting is Covered California is making a valiant effort, as I understand it, to target at least Latinos. I'm not sure about other communities that don't speak English as their dominant language, and still the numbers aren't there.
That's correct. And so one thing I've been doing is focusing on getting some of these folks in these different ethnic populations to work with insurance brokers who speak the language.
And navigators or insurance brokers, or one
both,
the same? Both.
And there are folks that can help people who have English problems with Covered California. And you can call these navigators or insurance agents who speak the language, and then we'll help you enroll.
But one area where Covered California has been criticized is they haven't brought on enough navigators. They had hoped to bring on about 16,000. I understand they're maybe at 5,000 now.
Correct.
It's problematic.
It is, but also they need to do their proper security checks to make sure that the person they're bringing on didn't commit fraud in the past and so on. And so again, the ramp up is slower than expected, but it is happening, and every week, every month that passes, it gets better.
What about Medicaid expansion? Is your sense that those numbers are strong?
Yes, and I fully support Medicaid expansion. I'm glad California is going full speed ahead and implementing.
One of 25 states right now,
Correct.
But your sense is folks are understanding it, they're participating in it?
Yes, and also keep in mind, the Affordable Care Act has many provisions. Signing up through Covered California is one of them. But right now, anybody who has a pre-existing condition simply cannot be denied coverage. That's amazing.
I hear you. His name is Ted Lieu. He's a member of the California State Senate. My name is Brad Pomerance. I want to thank you so much for watching Time Warner Cable's Local Edition.